What are the ethical considerations of ECT for schizophrenia? When discussing electroconvulsive therapy for schizophrenia, it's essential to consider the ethical implications involved. This treatment is often used for individuals who do not respond well to medication, known as treatment-resistant schizophrenia. However, the ethical landscape surrounding this therapy is complex and requires careful thought. One major consideration is informed consent and patient autonomy. Patients should have the right to understand their treatment options fully. This means they need to know what electroconvulsive therapy involves, including its potential benefits and risks. However, schizophrenia can affect a person's ability to think clearly and make decisions. This raises questions about whether patients can give informed consent. When a patient's judgment is impaired, healthcare providers face a dilemma. Should they proceed with treatment to prevent further harm or respect the patient's right to choose? Another important factor is the balance between beneficence and non-maleficence. Beneficence refers to acting in the best interest of the patient, while non-maleficence means avoiding harm. Electroconvulsive therapy aims to alleviate severe symptoms when other treatments fail. However, the long-term effectiveness of this therapy for schizophrenia is not entirely clear. Side effects, such as memory loss and cognitive issues, can be significant. Clinicians must weigh the potential benefits against these risks to ensure they are not causing more harm than good. Justice and fair access to treatment are also ethical concerns. Electroconvulsive therapy should be available based on clinical need, not influenced by stigma against individuals with schizophrenia. Patients deserve equal access to alternative treatments and clear information to make informed choices about their care. Paternalism versus patient rights is another ethical consideration. In some cases, patients may be unable to consent due to the severity of their illness. This may lead to situations where treatment is administered without consent to prevent life-threatening outcomes. While this approach may be necessary, it must be handled with care, ensuring that the patient's dignity and rights are respected. Finally, communication and trust between the patient and psychiatrist are vital. Patients who understand the benefits and risks of electroconvulsive therapy may be more willing to consent. Open and honest dialogue is essential to ethical care. In practice, ethical use of electroconvulsive therapy for schizophrenia involves assessing the patient's capacity to consent, weighing risks and benefits, and maintaining clear communication. This is especially important in treatment-resistant cases where electroconvulsive therapy may be considered as an additional option. The ethical debate continues, highlighting the importance of patient-centered care in decisions about electroconvulsive therapy.